This program was produced by and first broadcast on Radio Kidnappers, a community access media station. Thanks to New Zealand On Air for making this type of programming possible.
Good morning, this is Heiko from the Acupuncture on Air program. Today we've got another interview with our special guest from Melbourne in Australia, Ilana Sowter, who specialises in Chinese medicine, but in particular to women's disorders. So good morning there, Ilana. How are you?
Good morning, Heiko. I'm really well. How are you?
No, I'm all good. Apart from I got a little bit of remorse because even though this show is pre-recorded and it'll be old news by the time it comes out, but the passing away of Ginger Baker. And of course, you know, you being one of those younger people, you'd know all about him, wouldn't you?
Yeah. Not really, but I heard he was the hammer of the gods.
Yeah, that's right. Yeah, he was an amazing drummer for that amazing band called Cream, and we're going to play a song from them later when we finish the show.
Oh, great! Which song? Oh, we'll find out later, won't we?
Yeah,
leave it to the suspense to the end.
But what I've noticed that today's show should be quite popular and quite interesting for the people listening in, because it's a problem called pre menstrual syndrome, and I know that because it's so common. And what's the interesting thing, it doesn't actually have to be a problem now, does it, Ilana?
No. It actually is. I suppose one of those experiences that are common, but not necessarily normal for women to have. And, a lot of women do experience it, but they don't have to. That's right.
Because I think I read the stats is that 80% of women experience some symptoms associated with premenstrual syndrome at some stage or the other. And that's a very high amount. And I think that's why it gets a bit almost programmed into their psyche to think, well, I've got this, but that's normal. You know, and of course we know it's not.
No, and absolutely, and a lot of the research says that PMS can be quite subjective, as in, women can kind of create it in their heads, because apparently you have to have at least 5 symptoms, and then, effectively I could have it and you could have it as well. Yeah. Because, and the other thing is, there needs to be a lot more, I guess, stringent diagnosis to ensure that a woman actually does have it.
Yeah. Now tell us about the symptoms. What are the main symptoms that classically from the medical point of view, this means you've got premenstrual syndrome?
Yeah, so PMS encompasses a vast array of psychological symptoms, including irritability, anxiety, depression, loss of confidence, and mood swings.
Sounds like me.
Well, there you go. This is going to be a great talk for you, Heiko. Along with physical symptoms, bloating, nostalgia, which is breast pain, headache, and, to neck and shoulder tension. But there can be up to 150 symptoms.
Wow.
And so the diagnosis is defined by the symptoms occurring after a woman's ovulation until menstruation, which is her luteal phase, and they need to disappear once she gets her period. And one of the most important factors of diagnosis is the degree of impact it has on her life during that luteal phase.
Yeah, because I know with some of my patients, I think there's a few sort of outstanding things. One of them is the bloating, and the other one is the sore breasts. Yeah. And the other one is sort of, the mood swing before the cycle, which can be the irritability or can be the other way. It's sort of almost grieving and teary and over emotional. So, what do you find in your practice? Which sort of symptoms that come up with you more commonly? Even though we say there's 150 of them, but which ones are most common with you?
I would say in my practice I get more. I do have a few women who get like a full array of symptoms, like so many signs and symptoms that perhaps they could even be diagnosed as, PMD, the premenstrual dysphoric disorder, really bad. And then others, maybe things like breast pain or breast swelling, migraine, and neck and shoulder tension.
Okay, yep. Now, just one other thing that what I've been surprised on is when I'm talking to a patient, because usually they've come for something else, and then I do my sort of case history as we do with on the traditional Chinese medicine viewpoint, and then I start to find out they've got all these different types of PMS type symptoms. And then I say, we'll treat that as well while I'm treating you for that. And then they're often quite bewildered or surprised. It's sort of like, you can treat that. You mean it's not normal? Do you find with your practice, specialising in women's disorders, are you getting women coming to you and saying, Ilana, I've got, bloating and sore breasts from premenstrual syndrome. Can you help me with that? Or have they come for a stomach ache, and then you've managed to get the information out of them?
Yeah, I'd say I don't get many women for PMS because I think most women do put up with it, and perhaps they don't know that there is something they can do about it. So yeah, it is more so if they have if they're coming for fertility or some other gynae related issue like heavy periods or period pain, and then obviously it's interesting, isn't it, because they've got all these PMS signs and symptoms. Yep.
So I know that from a Western medical point of view, and this is where it's quite staggering that after all this time there's still no known cause of what causes these symptoms with PMS.
Yes.
And therefore there's no real prescribed treatment apart from, or maybe some anti-inflammatory drugs, or sometimes they might just go on the pill.
Antidepressant. Yeah, or the pill. Yeah.
And but from a Chinese medicine point of view, why don't you sort of tell us, and from a herbal point of view, so tell us what are the causes of premenstrual syndrome according to Chinese medicine?
Yes, I will. And before I go into that, just quickly, I recently just had a look at the research for PMS, for what causes it, and apparently women who drink alcohol are more likely to have PMS. Mm-hmm. There was no studies that could prove caffeine did affect it, and women who were overweight or obese were more likely to have PMS as well, which is interesting. And then from a Chinese medicine perspective, there's things like the diet, a regular eating, irregular foods can contribute to it, and overwork, because I suppose draining the body, the liver yin and the liver blood can affect, or the yang as well. And then the biggest factor, I believe, would be the emotional strain, and just like you said, perhaps it is entering the psyche of women because it is so common, and that could be from long-term repressed emotion and negative thinking.
And does this affect a specific organ or a meridian? These underlying causes?
Yeah, look, it definitely affects the liver meridian and organ energy. But actually it can, that is probably quite a fallacy. Like a lot of people in Chinese medicine would think, PMS, it's got to be...
Always liver, yeah.
Always liver, but it's not. It can be so many, it can be any of the organs, actually, and it can be related to a yang deficiency or an excess of yang.
Well, it's interesting. Before you said, like from the Western medical research, they said that obese and overweight women have a problem. And see, this ties in with Chinese medicine for our traditional diagnosis with obesity for phlegm and damp. And then you see if phlegm and damp accumulates, blocks, stagnates, then that affects the menstrual cycle, and then that affects the mood, the blocking, and give you those specific symptoms. So it all sort of ties, and then the alcohol, of course, ties in with the liver. So it does sort of make sense. But I'd like to just a little bit on this show to talk about some Chinese herbs associated with premenstrual syndrome, and I know, and you know that there is quite a well-known herbal formula called Xiaoyao-san.
Yeah, Xiaoyao-san.
And I think it goes under the name Free Rambling Formula, or
that's right, or the Free and Happy Wanderer.
The Free and Happy Wanderer. Yeah. So
I won't give that to my patient.
So why don't you I think legally we're not allowed to say that
Right.
it treats this, but I think legally
No,
we're allowed
we
to
can
say
treats liver qi stagnation.
yeah, it may help, you know.
Yes.
Yeah, but just tell us a little bit about the formula and just how it may help.
Yeah, absolutely. So Shaya-san, it's a modified, I suppose you could say it's a modified Dini-san, which is the 4 extremities powder, and it's a Chai-Hu formula. And so it generally regulates the liver and harmonises the spleen. And it's widely used in Asia for, women's conditions and stress and low energy and things. And I believe it's a very safe formula, like the herbs in there. As long as you're taking good quality herbal medicine, it's a very good, safe formula. It regulates liver qi, moves qi, tonifies the spleen and tonifies blood. And I find if it's prescribed to the right pattern, the right person, they will experience less sugar cravings, more energy, they generally feel better, less pronounced PMS symptoms and menstrual symptoms as well.
Yeah, because I think that's something that I just sort of like to stress in terms of, traditional Chinese medicine, that, the formula is good, it's fantastic, if it's perfectly suited for that person's, true diagnosis and picture. And I think, unfortunately, it gets that reputation. It's good for every woman, every time for menstruation, which I'd like to stress that if you see a traditional Chinese medicine practitioner, a qualified herbalist, it may be that they would use that formula, plus they could add herbs to the actual combination. Like, for example, I'm thinking, you could add a herb or herbs Daoren and Honghua, which is sort of peach kernels and safflower.
Yeah. It's a great herb for PMS.
Yeah. If the woman has also like clotting and more pain and things like that.
Yeah.
But in other times, of course, like if the patient, as you say in your case, was overweight and we had a phlegm damp condition, it wouldn't be the formula of choice. So
it wouldn't really do much, would it?
You want to tell us about any other herb things or any other formulas?
So sure. And just recapping in TCM in that premenstrual phase of what's happening in the body, the liver qi is moving in preparation for the menstrual period, and at the same time, the yang is rising to reach a maximum just before the onset of the period. So those women who have excess yang or yang deficiency can also manifest different signs and symptoms. And look, regarding the herbal medicine, like as you know, Shaya-san, you can always, if they've got a bit more heat signs and symptoms, you can add some cooling herbs like Mudam Pi and Zhezi, which will make it Jiawei.
Yeah, because I know that some women, they definitely complain about the heat stuff. They say they feel thirsty, they get this flushing, and with that a certain sense of anxiety. So I think that's the beauty about being able to modify the formula to suit the individual patient. Yeah.
Do you have any favourite formulae that you use?
Well, I wouldn't have a favourite formula, so it always comes sort of back to the to the patient, but
the individual.
But a common symptom that I do see with the female patient, that is the tiredness, and I think a lot of practitioners or self-diagnosed Googleites, as I call them, they lumber the tiredness into this pattern of deficiency or weakness, and then it's sort of like you think, oh well, I'm tired, therefore I'm lacking something, so I need to add something. So they're into sort of like, I have to add some magnesium and add this, and then I add this herb, and then and even Chinese herbs. People think, oh well, I'm tired, I'll add ginseng or I'll get astragalus. But the problem is that this actually only worsens the problem, because it's like your I don't know, it's like your engine is all blocked with old oil and things like that, and then so you think, oh well, I'll fix that, I'll just add more oil, and
then you're adding to the blockage.
That's right, and then that escalates the problem more. They feel more tired and more irritable, so then they say, oh well, I need more tonics.
Yeah.
Yeah. But anyway, listen, fortunately I can see Ken waving over there that we're running out of time, and I'm getting really excited about playing my closing song.
I know, can't wait to hear what it is.
Yeah, so but thanks again for coming onto the show, Ilana. And
you're welcome. Thank you for having me.
We're planning another 3 more shows for this year with you. So
I know, it's so exciting. Thank you.
We're getting great what do you say, exposure on the YouTube, and sort of.
I know, it's awesome.
We're getting right up there, going viral. All right, so thanks again, Ilana. And as I said, this show is dedicated to Ginger Baker, and with that was my my favourite Cream song, White Room, which was written by Jack Bruce, who was the bass player in Cream, and also Pete Brown. I think he was a poet or something. But Ginger Baker always claims, till his last dying moments, that he added the 5/4 opening and the middle in it, but he never received any credit for it. But anyway, so here it is. I'm giving him credit for it,
song.
And here's the song.
Great, thanks, Heiko. Okay, see you guys.
See you later.
Bye.
This program was produced by and first broadcast on Radio Kidnappers, a community access media station. Thanks to New Zealand On Air for making this type of programming possible.